made sure that we don't have any bubbles in our line. It's time to put our IV site in our patient. So what I'm going to do is I'm going to set down a linen barrier. Okay. All right, Miss Dole. I'm going to put this tourniquet around you, and we're just going to look for a good vein, okay? How are you with needles? Oh, you don't mind them? That's great. This should be no problem then. Okay. Now, I want to get my tourniquet not too tight so that I don't have a pulse, but tight enough that I can actually see that vein popping up, and I do see that there. So now that I know where I'm going to go, I'm going to release this tourniquet for now, just for comfort of the patient. I'm going to wash my hands and grab some gloves real quick. I'll be right back. So I've got my gloves. I'm going to just get my stuff opened up here. Window opened up here. Here. So the first thing I'm going to do is I'm going to get my alcohol swab here and clean the site that I'm going to be putting IV in and allowing that to dry. You want to let that air dry. You don't want to fan it or anything. Just let it air dry. I'm going to reapply this tourniquet. And then I see this vein here. It's looking pretty good. I'm going to uncap my needle. Okay. And I'm going to want to put that in no deeper than a 30-degree angle with my bevel up. And I want to go in to that vein until I feel a little give. And then I don't want to go any more. I see a little flash in there. Hold that vein. And that out. Okay. I want to get my Lura-Lock on here real quick. Okay, now that I've got that on there, and I know you weren't able to see that, but you want to make sure you have a flash in there, which I did. Now I'm going to secure my Lura-Lock. I'm using a chevron method. keep that secure. Now I can go ahead and attach my IV. Okay, make sure a little bit drips out here. Again, to make sure I don't have any bubbles. We've already checked the line, but I don't want to put any air in when I put this in. Okay. Secure that. Okay, now that we've got that set, and we can see that we can administer, we'll go ahead and my banana is actually pretty good. I don't have any blood or anything, so I'm just going to go ahead and put some gauze down. Underneath for comfort. Turn this tubing so that it's comfortable and we don't have any tension there. And then I'm going to put this on. This is this needs to go over the IV site to keep it clean, but not over the lower lock. And we'll just smooth that out. And it has today's date, the patient's the gauge of the needle, and my initials. Okay. And then we're going to make sure we have the patient's name, date of birth, and initials on the bag here. We also have the infusion time that we started and when it should end in the infusion rate. So let's get that set now. And we're going to set it for 1 drop or 5 drops every minute. Okay, so that's about right. Okay, and then I'm just going to label this tubing so that we know when that has to be changed. Okay, so how are you feeling, Miss Dole? Okay, great. I'm just going to leave this call light here. Is there anything I can do for you before I leave? Wonderful. Okay, there is your call light. And the doctor will be in to see you shortly.